Hello, it's Dr. Rhonda Johnson. Today is Tuesday, May 30th, 2023, and I did not want this month to end without talking about stroke, because May is Stroke Awareness Month. Now, you may already know this, that stroke can be deadly. It certainly is very common. It's a leading cause of disability in America and the fifth leading cause of death. If you don't remember anything else, remember FAST, FAST. These are the warning signs of stroke. F stands for face drooping. A lot of times, the one side of the face is numb. The person can't smile, and their face just looks distorted. A stands for arm weakness. Is one of the arms weak or numb? Ask the person to raise both arms. Does one arm drift down? S stands for speech difficulty. Typically, a person having a stroke will have very slurred speech. 1 minute they're talking normally, the next second you can't understand them. And T stands for time. Time is of the essence. Every minute counts with stroke. So call 911. Say, I think whoever it is having a stroke. Please get here right away. Other symptoms of stroke include severe headache, trouble seeing, trouble walking, being confused all of a sudden. So again, those are the signs and symptoms of a stroke. Now, like everything else, stroke risk factors include things that you can control and things that you can't control. But here are some of the leading causes of stroke that you can take actions to lower your risk. Number one is high blood pressure. It's a leading cause of stroke, and it's the most controllable risk factor. You can be on medication that lowers your blood pressure and the lifestyle changes, but most people with high blood pressure need medication to control their blood pressure. Smoking, the chemicals in the cigarette smoke cause the blood vessels to vasoconstrict. The more cigarettes you smoke daily, the higher your risk of stroke. So you want to do everything you can to either not start smoking or quit. Now, type 1 and type 2 diabetes increases your risk of stroke. Diets that are high in fat and cholesterol can increase your risk of stroke. Those that are high in salt can increase your blood pressure and increase your risk of stroke. Now, I already said high blood cholesterol is a risk factor because it can make the inside of the blood vessels sticky and form plaque, which can fall off and get inside the blood circulation and go to the brain and cause a stroke. Another cause of stroke is atrial fibrillation, or AFib. You probably hear a lot about that on TV. It's a leading cause of stroke because your heart beats irregular, and again, you can form blood clots. So those are some of the leading causes of stroke in adults. Now, sickle cell disease, sickle cell anemia, is a leading cause of stroke in children. The highest rates of stroke in patients with sickle cell disease occur between the ages of 2 and 16. So they should be screened with an ultrasound, a special ultrasound, to look at their risk for stroke. So now you have some of the risk factors, the signs and symptoms. Please share this video. Take steps to lower your risk for stroke. That's my message today. Be safe and be well.